Across the National Health Service, there is now growing evidence of the preparations underway to cope if the influenza virus becomes more widespread. At Basingstoke Hospital in Hampshire, high-risk groups showing any symptoms are being urged to stay away for fear of infecting this closed environment. And like hospitals around the country, long-rehearsed emergency plans are starting to be implemented.
We're doing daily briefings to our staff to tell them what to do for their own accord, but also in terms of treating patients and the message that they should be giving to the public.
Sky News has spoken to the country's strategic health authorities to try to gauge their state of preparedness. The East of England SHA told us they don't stockpile face masks, ventilators or antibiotics. The West Midlands has small stockpiles of face masks and ventilators and, like other health authorities, can quickly access supplies of antibiotics and antiviral medicine.
Once it gets to a stage, though, where you end up with people getting infected in multiple locations within the same community, then the government needs to take a different approach then. They can't continue to trying to prevent that from spreading around isolated family members and so forth. They need to take a different strategy.
This face mask manufacturer in North East England is working around the clock to deal with the extra demand for their product, although health officials warn the benefits of such protection can be limited. Much more effective is basic hygiene.
Now go and wash your hands again.
And for high-risk groups like frontline health service staff, such advice is vital.
So as you can see where the gel's showing up, these are the areas for hands that are most commonly missed during hand washing. So the dark areas like around your nail bed and the thumbs. If you turn your hands over now and have a look at the other side, again you've got areas that you've missed around your thumb, and if you have a look at your nails, around the nails, these are the areas of the hands that are most commonly missed when we hand wash.
Because of their close contact with infected patients, NHS staff are expected to feel the brunt of any outbreak if it becomes established. Absence levels could be very high. Sky News has been told the government has plans to call on the services of retired GPs should the situation deteriorate.
We also have buddied with a local surgery, so if, God forbid, our staff are ill and they can't come in, we have mechanisms for patients to be seen locally at another surgery.
For the moment, the official advice is to contact NHS Direct by telephone if you're showing symptoms. But health officials know as the outbreak takes hold, increasing numbers of people will begin turning up at doctors' surgeries and hospitals. Mark White, Sky News.